Hello and welcome to Health and Wellness Myths and Facts. I'm Ankita Mukherjee. Now, health and wellness are essential, of course, to living a fulfilling life. But as the body ages, it does become more prone to medical conditions. Aging can't be prevented, but we can learn to deal with the issues that arise in order to keep our loved ones in good health. People are actually living longer all over the world. Most people nowadays can expect to live well into their 60s and beyond. And every country in the world is also seeing population growth as well as an increase in the number of elderly people. So what do we know about aging? Well, it does lead to a gradual decrease in physical and mental capacity as well as the growing risk of disease. The prevalence of most chronic diseases and conditions like diabetes and heart ailments also increase with age. Now, proper knowledge about chronic conditions can help the elderly manage these conditions well. There are many queries, and as always, we're joined by medical experts to address your doubts. Joining us on the show today, Dr. Aravinda J, MBBS, MD, MRCP, London, Triple FRCP, Edinburgh, London and Glasgow. He's the immediate past president, RSSDI, Karnataka chapter, and also with Dr. Arvind's Diabetes Centre in Bengaluru. We're also being joined by Dr. Rahul Sharma, MBBS, DNB Medicine, DNB Cardiology, Head of the Department and Consultant Cardiologist, Fortis Escorts Hospital, Jaipur. Dr. Aravinda J, let me begin by asking you, almost all senior people seem to have at least one or two chronic health conditions, but what are the most common illnesses or medical conditions that are seen in the elderly?
Yeah, it's an important question because as you rightly said in your introduction, now the elderly people are increasing in all over the world. So many infectious diseases are common, and many chronic diseases are common. So we have to divide among two things. One is the infectious disease, and another is the chronic disease. The chronic diseases like diabetes, hypertension, heart diseases, these are very common in elderly patients. On the other hand, we come across many infectious diseases, mainly pneumonia or other chronic obstructive pulmonary disease or respiratory condition or abdominal infection. These are all more common. Recently, we all seen during this COVID pandemic how the infectious disease like COVID pneumonia was more common in elderly. All this is because of reduced immunity and associated medical condition. But this can be tackled if appropriately recognized and treated correctly. These things can be prevented.
Right. Let me also take this across to Dr. Rahul Sharma. Now, medical advances have helped to increase life expectancy among people, but have also made people, have to live with chronic conditions. So what lifestyle changes would you suggest, doctor, so that, people can live long but also live healthy?
Okay, thank you very much for this. This is a very important question. And these are some of the most basic things in the life which can be done. Like elderly people should, as such, have healthy, nutritious food which is good for the body. And number two is specifically for the Indian people, they should have a very less salt intake and more so the elderly hypertensive people, because as such we tend to get more salt per day than any other country across the globe. In those having diabetes, I would suggest those having diabetes should have a low calorie diet, not excessing what is required by them by their doctor, because if you have a high calorie diet, it not only leads to not having a proper diabetic control. In the longer run, it tends to have many problems. Also, the elderly people specifically should de-stress with something like yoga, light music, etc., because as you know, stress in the modern world is one of the most common factors leading to not only heart disease but also mental disease. And yoga, pranayam, etc. will definitely help in de-stressing a lot.
Right. Dr. Aravinda, the elderly are more likely to have chronic conditions. There could be malnutrition or multiple medications that also take their toll. Hypoglycemia is also common in elderly people with diabetes. So, give us a sense of the targeted blood sugar levels. What is appropriate? What should they be monitoring for and hope to keep? What is the range that they should be within?
See, hypoglycemia is an important aspect. So we have to take into consideration and never allow our diabetic patient to go in for hypoglycemia. So diabetes is always an individualized treatment. Like for younger patient, we keep very strict criteria. At the same time, for elderly patient, we will not be so strict because we don't want them to go for low sugar. So for this, what target we keep is the fasting plasma sugar should be around 100 to 120. That should be okay. Postprandial blood sugar around 200. If you keep it around 200, that is random blood sugar around 200, that is also good. And if you take the 3 months average HbA1c, we will keep it around 7.5. The main thing that the elderly patients should do is take their medications correctly. At the same time, they have to eat regularly. In the sense, the morning breakfast should be at time around 9 to 9:30. Lunch is around 1 to 1:30, and the evening dinner should be around 8 o'clock. In between, in the sense around morning 11 o'clock and in the evening 5:30. If they take some snacks, they can definitely avoid this sugar fluctuation. The main thing is they should always know this point of low sugar, that is sweating, hungriness, giddiness, weakness, tiredness, lethargy. If anything's come across, they should definitely check their sugar levels, and the treatment has to be taken appropriately.
Dr. Rahul Sharma, let me ask you that same question with regard to target blood pressure and cholesterol levels. What is it that elderly people should be maintaining in order to have, a healthy life and a normal life?
This is again a very judicious and important question, in the sense that as per the various guidelines and studies which have been there, that is the American College of Cardiology or AHA guidelines,
right,
your elderly people somewhere in the age group of say 60 to 70s, we don't target a very strict BP control. It should be something about 140/90, because what the problem occurs if you go in for a too strict BP control. Now in these patients there is a chance of a postural hypotension. They may have something called a syncope, which we call as they may have a drop attack, they may have fall down and all. So you can't go in with a very strict control. And specifically in your very elderly patients, somehow they are more than 80, then again that is more relaxed a bit. So this is two important points. Now the thing is that if you have a concomitant, means together with the hypertension you have a diabetic or a kidney disease, in that context, to prevent some complication from happening, you need to have a bit stricter control of your BP. And in those patients we advocate a home BP monitoring, so that neither it shoots up too high or it doesn't go too low. So in elderly, definitely the criteria are a bit relaxed.
Right.
Also, as per the cholesterol, it depends on whether you have a pre-existing heart disease or not. If you have a pre-existing heart disease, as per the latest guidelines, you should ideally be having the LDL, that is the low density cholesterol, which is actually a bad cholesterol, less than 100, and in some particular cases less than 70. The triglycerides, again, a certain point of bad cholesterol, you tend to keep it. The advocacy is less than 150, and in certain cases less than 100 also. It all depends on your pre-existing, whether the patient is asymptomatic or he is having a heart disease or not.
Okay. Now, Dr. Aravinda, some new technologies have made life easier for people with diabetes. The insulin pump is talked about as being one of them. How safe and effective is the insulin pump for use in elderly people?
Yeah, insulin pump is one of the latest technology which is quite being used across India as well as globe. Even in my practice, I use insulin pump. Insulin pump, to tell briefly, it's an machine, small machine, just of a mobile size, where they can keep it in the waist, where the insulin is adjusted, the dosage of insulin is adjusted so that it will deliver on its own. So the patient need not take the injections regularly, because as a doctor, as the company person of the machine will come and educate the people how to use it. But according to me, the insulin pump is a biggest boon in the management of type 2 diabetes patient or type 1 diabetes patient, especially in elderly patient, because the dosage of insulin is adjusted. So there is nothing to worry about the dosage, like how to take, when to take, like whether it is 2 times or 3 times, like that. So there is a constant delivery of insulin, and we monitor the sugars accordingly. That what we do it as a continuous glucose monitoring technique, where the sugars are monitored regularly. So by doing this, the patient's erratic blood sugar can be avoided. The patient will neither go for hypoglycemia or they'll not go for hyperglycemia. So definitely this medical technology is a biggest boon in the management of type 2 diabetes in the elderly.
Right. We will take a very quick break at this point, but there's a lot more to talk about, including sleep, just how many hours is necessary for the elderly, how do you counteract sleeplessness, and also tests and investigations, how often we need to do them. When we come back, we'll have all those questions answered for you. Welcome back to Health and Wellness, Myths versus Facts. Let's take our questions straight across to our medical experts once again. Now, Dr. Sharma, how frequently should older people with comorbidities like diabetes and hypertension actually go for blood tests and other tests? Apart from blood tests, what else should they be investigating?
See, we must be absolutely sure when we are talking of people with chronic diseases like BP, like hypertension, diabetes. We have to separate them between two, like whether they are asymptomatic elderly people or do they have some pre-existing cardiac history. So first of all, I'll tell you about asymptomatic people. So now suppose you are asymptomatic elderly, then you don't need a very frequent checkup. You once in 6 to 12 months, you get a preventive health checkup done. And the tests which are done are like a simple blood test, like complete blood count, your lipid profile fasting, your HbA1c, which sees a 3 months lipid profile, and some other blood tests like liver function test, etc. Cardiac wise, if you have to risk stratify, you can do with a simple ECG, echo, and if the patient can exercise on a treadmill test, that is the best. Suppose in certain conditions, due to some joint pains, etc., which you get in elderly, you cannot get a treadmill test done. You have other modalities like a dobutamine stress echo or a CT coronary angiography, etc., which are there to risk stratify a patient. On the other hand, if the patient is already a cardiac patient, he has gone under some procedure like an angioplasty or a bypass in the past, in that case, you have to get a follow-up which is quicker, 2-3 months fast, not more than 2 to 3 months. He must visit a doctor in 2 to 3 months.
Right. I was talking earlier about sleep. Now, Dr. Aravinda, people who have diabetes often have poor sleeping habits as well, including a difficulty in falling asleep, or even if they manage to fall asleep, then staying asleep. And that seems to be more common among older people. So my question is in two parts. How much sleep is necessary for older people, and how do they sort of improve the quality of their sleep?
So that's an important aspect. Sleep is one thing where all the human beings is like to lead a comfortable life, they need a good amount of sleep. So if your first question is, if you ask me how many hours a person leads a sleep, so normally if it is around 6 to 8 hours, that should be enough. Like anybody, it's not irrespective of the age. Any person, if you take for that matter, 6 to 8 hours is mandatory. But how do you manage this sleep? As you rightly pointed out in your question, many diabetic patients will have a challenges of getting a proper sleep. So what I generally say to all my elderly patients, to avoid afternoon sleep. If they want to take power nap like for 5 to 10 minutes, that is fine. But they should not sleep for a long hours like 1 hour or 2 hours or 3 hours in the afternoon. So if they sleep in the afternoon, obviously they don't get a good sleep in the night. So they have the problem. They come and tell me, doctor, even after 12, 1 o'clock in the night, I don't get a sleep. Even if I sleep for at 1 o'clock, I'll get only around 2 to 3 hours sleep. So better is to avoid afternoon sleep. Another good habit where the elderly patients can do is they can go evening walk at least for 15 to 30 minutes, maybe around 6:30, 7 o'clock, whether it may be park or on a nearby house also, it's okay. If they do that, the body will have a strain and they will have a comfortable sleep. So generally I say go to sleep around 10 o'clock, get around 5:30, 6 o'clock, go for a walk and keep comfortable. So by doing this, they can ensure that 6 to 7 hours sleep is very crucial for an elderly patient.
Right. Dr. Rahul Sharma, regular exercise and being physically active is something doctors recommend to absolutely everybody, and I'm sure it's no different for the elderly. But how much physical activity is recommended for the elderly, specifically those who have heart disease as well?
See, again, the basic tenet of this is that you need the adequate amount of exercise which is good for your body without causing any harm. So, for the elderly specifically, it is light exercise, but which should not be, go into very strenuous exercise. So, the basic understanding is then when you exercise, it can be something like brisk walking, it can be something light jogging, or even supervised aerobic exercises is fair enough. Now you should feel fresh after exercising. You should not be feeling exhausted after exercise, because if you tend to feel exhausted, specifically in cardiac patients after exercise, so can be a problem. Brisk walking and slight jogging, etc., is quite good. Also, on top of that, that this is taking part of your health as such, health. But for your mental health, I would also advocate, specifically in cardiac patients, it is a must that you do some part of yoga and pranayam, because modern studies have shown that yoga, pranayam, concomitant with your light exercise, is very good for your cardiac patients as such.
Right. Dr. Aravinda, portion control and balanced diet are, of course, key factors in a healthy lifestyle, also crucial for managing diabetes. But sometimes that becomes more difficult when it comes to elder patients. So what are your recommendations about the diets they should follow, how much they should eat, how regularly, and at what intervals they should be eating?
Very important question about diet, because there is nothing like in diabetes diet. It is always an individualized diet. What I say is each person has got a different eating habits, and their taste is different and their liking is different, whether it may be a vegetarian or whether it may be a non-vegetarian. When a person comes to our clinic, elderly patient especially, we talk to them what are their likes and dislikes. Based upon that, we'll prepare a special diet in such a way the carbohydrates should be around 50 to 55%, or take it 60%, and protein should be more. We Indians lack in protein intake. So the protein intake should be anywhere between 25 to 30%, and rest of the portion is from the fat. So three division we do, that is carbohydrate, proteins and fat. Most important thing is, according to the likings, we would have the dietitian would have told them what to take and what not to take. But most important thing to remember is to take the food regularly. The intake should be very regular. In this sense, instead of taking 3 heavy meals, they should take 5 small meals. So by doing this, the erratic sugars can be avoided. Means sometimes the patient will have hypoglycemia or high sugars. So these things can be avoided. So I always tell morning 9:30 breakfast and 1:30 is the lunch and 8:30 is the dinner, and the snacks time is around 11 o'clock in the morning and 5:30 in the evening, where they can take some salads or sprouts or dry foods, something like that be taken. So by doing this, the portions of food can be balanced and the patients going in for hypoglycemia can be avoided.
Right. Dr. Sharma, one final question. Obviously, it's not just the pandemic. Sometimes it's living alone. Sometimes it's just the management of various ailments and chronic conditions. But the elderly do undergo a lot of stress. It's a vulnerable age. There's emotional and physical stress. What tips would you give for the management of stress among the elderly?
I feel this is the most important question you have asked, because post the COVID endemic era, believe me, I have in my chronic patients, cardiac patients, there has been a huge surge, not only in stress, but other depressive tendencies, etc. So, number one, I would say that the elderly are a very important people. They have made us actually what we are now today. So, we should always try to keep them happy. Number two is that keep them involved, even if there are geographical distances separating you whatsoever. That may be there thousands of kilometers between you and your elderly, but keep them involved over phones, video calls, or whatever. So once they feel involved, they won't slide into any sort of depression or anxiety, which is quite common among this COVID time, and also due to the chronic underlying conditions which acts as a trigger. Now, even if in spite of this, they are triggering in depression or anxiety, something of that occurs, please do not hesitate to take a professional advice. Like a professional advice, it can be in the form of a clinical psychologist, it can be in the form of a counselor who will first try to treat it without any medications. Now, if in spite of that it is occurring, you might have to also go in for a psychiatrist and take the medications, which may ultimately be stopped. But having an anxiety or a depressive disorder on top of a chronic disorder is very common. That is happening across the world to celebrities, everyone, believe me. So you should not ignore it, that which is a common tendency in India, to just ignore it, that it doesn't exist. This is a very important facet of the medical science and should be taken up by everybody, and the family members should be involved the most, keeping the elderly happy, because if the elderly are not happy in our population, believe me, we are not doing good for our society as a whole.
All right, that was very comprehensive. Dr. Sharma, Dr. Aravinda, thanks very much indeed for addressing this wide range of issues affecting the elderly. We hope you found this program useful. Thanks for watching.